you, we're going to talk about brain health today, and you're making some interesting points about this because we concentrate on almost everything else, but we don't concentrate on the brain.
No, I think it's a huge subject, brain health. And, when we look at different types of diseases and what I see in my clinic every day, we're seeing more of neurological type problems, neurological based problems, neurodegenerative type diseases. And at some point, we're going to have to begin to screen the brain. Now, as I was saying to you off air, that we screen the bowel for bowel cancer and diverticulitis and Crohn's and all that kind of stuff. We screen the breasts, we screen prostates, lungs, we screen everything, but we don't screen the brain. And it's always amazed me as to why that is the case. So if you take people out there who have different types of illnesses, let's say, for example, depression, even anxiety, why aren't we scanning the brain? Because this is the organ that's primarily involved. Also, you look at the increase in vascular dementia or indeed Alzheimer's or other types of neurodegenerative type diseases. Could early screening of the brain identify this and prevent it from manifesting as a serious problem? The evidence, Fran, is that is the case, that it can be detected many years later, as indeed can cancer and other type diseases. So I think it's an issue that really has to be addressed from the neurological perspective, that some sort of mechanism is put into place to look at the damage that's being caused to the brains of our young people at the moment, but the amount of damage that any of us could have walking around and thinking, well, we're okay, it won't happen to us, when it actually could.
I remember growing up, and it seems to me now, looking back, and not time you'd hear about somebody being senile a bit, or as you say, somebody doting a little bit. But it doesn't seem to me that there was those kind of numbers of people with Alzheimer's and dementia. Or what's happening to us?
Well, look, there's no doubt about it. Our lifestyle has changed. And Daniel Amen, who's a psychiatrist, he has done 160,000 SPECT scans, SPECT scans. Now, anybody can go on and look at his research, all the documentation, all of the papers are published. So the science is there to show that people, for example, with the dementia or vascular dementia or Alzheimer's or anything like that may, some brain injury or brain issue, that this can be picked up in 30 years earlier. So if people were, let's say somebody's genetically predisposed to something like this, well, maybe it might be wise to look at the brains of those individuals using SPECT imaging and to see if there is some degree of lack of blood flow or oxygen, and the whole idea of the SPECT scanning is that it looks at the increased function or decreased function of the particular area of the body. It's part of nuclear medicine that it's trying to identify problems with. So therefore, the evidence is clear that they're showing in imaging that brains are showing that problems are there long before they materialize. And we see high impact sports, for example, rugby, Gaelic football, hurling. We see guys are much stronger. We're seeing impacts on the field. Is this going to have huge problems? Absolutely it is, because I'm seeing young guys coming into the clinic who are suffering from different types of concussion and concussion type trauma, and we think that in time that will go. That could lay the foundation for something. So you have to be very mindful. We look at the amount of children who are diagnosed with autism or within the autistic spectrum. We're seeing it, we're just making a diagnosis based on a cluster of symptoms, but nobody is scanning the brain and looking at the different areas of the brain, the executive functioning, the amygdala, the different quadrants of the brain, and saying, yes, there is certainly an over-function of one part, there's lack of function in another, and what is the real reason? And it's a matter of looking now, I think, at the huge implications of modern day living and how it is impacting not just on our lungs and our heart and our kidneys and our bladder and our bowel, but it's also having a huge impact on our brain.
And when you say modern day living, are you talking about diet?
Diet is one aspect of it. Diet is for sure one aspect. There's a reality now that the bigger your body gets, the smaller your brain gets. Okay, and the reason for being is because metabolism. We have 60,000 miles of vessels in our body. So when our microcirculatory system and our metabolism becomes affected, then this has a huge impact in blood flow to the brain. Lack of blood flow and oxygen to the brain, using the model of living and the stress and the poor diet, the sedentary lifestyle, the overuse of IT stuff, all of this is playing into an environment that is influencing every organ of the body, but not just our organs, our brain is also being influenced. And when we see the huge increases in the anxiety in our society, people seem to be lost. We see a huge increase in depression, and people are struggling out there. And we're going down the road trying to Xanax our way out of this. It's not going to happen. We need to make serious changes in the education of our people to get them to change their lives. Otherwise, we are heading in for massive health issues.
If we discover that somebody is predisposed, or we get somebody in the very early stages of these degenerative diseases,
Yes.
Can it be rolled back?
Absolutely. The evidence is there to show that you can prevent that. And the evidence is there to show that these types of conditions can be reversed. So if people are building up various types of plaque in the brain, for example, so what type of scan? So if the SPECT scan, so what could you look for? You could look for blood flow, MRA, magnetic resonance angiogram. I often send people to Professor Sultan in the Galway clinic who might present with some symptoms just to look at blood flow, for example. And when you look at, that's one of the big things, blood flow, because blood carries oxygen and nutrients to the brain. But what about blood flow? How, we lack exercise. We're, our food, we're overweight. We're, for the first time, Fran, for the first time in history of the human existence, people are dying from overeating rather than hunger. So now we've got to look at blood flow as a contributor to the problem arising from that. And of course, we have the people who retire, stop learning. So we can look at how it is that we can identify the problem, then engage in a rehab program that looks at lifestyle, looks at continuous learning, looks at brain rehab programming, looks at getting out in nature, and reconnecting again back to life. And suddenly the body starts to rehab from there. And we're seeing that. In people coming into our clinics who have various types of neurological based disorders, whether it be Parkinson's, MS, whether it be something like vascular dementia or whatever the case may be. We're seeing that when people are making these lifestyle changes, not just we're seeing it, but the science shows it. And the regrettable thing of all of this is that even though the science is there, regrettably, the powers that be, as the healthcare service, the neurologists, the various consultants, they're not bringing this new awareness into their clinical practice and educating people about this.
It's very interesting. Correct diagnosis, I would imagine, is vital, isn't it?
Well, that's a powerful question, because they are the three key things we have to ask when people come to our clinics. Where is your problem coming from?
Yes.
We know how it's affecting you, but how you're dealing with it. So the key here is diagnosis. And we see clusters of symptoms. So when you look at diabetes, for example, diabetes, there should be no disease called diabetes. Okay? What people have out there is very simple. It is called processed food disease.
That's what it is.
That's what it is. Processed food disease. When we look at the food that we're putting into our body, and there are some people, I get it out there, who can't afford to go down the organic route and, have to buy certain foods, and I get that. But, we have got to try and find a way to look at how the food industry has hacked the human brain, and using certain methods of advertising is able to influence the person at the other side of the screen to say, well, if you eat this, you look like this, or whatever the case may be. And of course, it's all advertising. So we have this kind of, they've hijacked and controlled the brain and diverted us down the road into a model of living of processed food, lack of exercise, resulting in what we call processed food diseases, looking at conditions like diabetes, cancers, neurodegenerative disorders, anxiety, depression, all of these things. It is the same system that is contributing to all of the different conditions that are presenting in doctor surgeries and that are presenting in hospital A&Es and in various consultants' rooms today.
That's very interesting. I was reading a piece on, I forget which platform it was the other night, but it said that the biggest poison that's affecting us has to be sugar. That it's worse than drugs, it's worse than anything else, that sugar is the big one. Would you go along?
Well, look, there's no doubt about it, sugar, because one of the key things that we have to think about is that, and again, going back to Daniel Amen and all that type of research that has been done looking at SPECT scans, the scans show areas of the brain. So if people who overuse alcohol, people who use drugs, cocaine, weed, whatever the case may be, even medically prescribed drugs. Also, food, of course, sugar, because sugar is going to create inflammation. So one of the key things when we look at blood flow, lack of blood flow, oxygen, nutrients, so we can look at that now by looking at food and looking at exercise. But the critical thing about the food is you bring down the inflammation. The idea that we can class a lot of these types of conditions as autoimmune diseases is not really accurate. We have the immune system is responding to problems. So we can target the immune system with immunosuppressants and steroids and all of that kind of thing. Short term, people may need it, but we need to go back and look at why the immune system is overactive. And it's overactive because it's trying to deal with problems within the body. And you're right, sugar is one of the biggest things, but it's in everything. And this is the problem with life today. But at least if we can cut out the processed stuff, and that's the big thing. When and I'm sure people see this in their own families, that we unfortunately, we are not sitting around the table anymore eating. We're taking fast food. It's easy to, and I'm not saying that you can't have a takeaway or go to Chinese or go to some, absolutely. But it's all about balance. But when we look, so what I'm saying to people is this, if just have a look in the mirror, let your body tell you the true story. Are you tired today? Do you feel that you have no energy? Do you lack concentration, focus? Do you feel you lack motivation in life? Do you feel that you're a little bit overweight? All of these things. The thing about it is this, when people make simple changes in their lives, and of course the food is a big challenge because it is addictive. Like you said, sugar is addictive. And if you were to say to everybody today, give up your sugar, wouldn't happen. I mean, I talk to people every day in my clinics. I say, no, you cannot give up sugar. What you have to do is you have to replace it. And you start to reprogram the brain. So when we look at rehabbing the body, we rehab a muscle if we tear it. If we damage and cruciate ligament, we rehab it and whatever. So the whole idea is that we have to learn to rehab our body. We call it healing, but we have to rehab it. We have to rehab it with the proper rest, the proper food, the proper therapies, the proper support systems. But the ultimate focus has to be the patient themselves. They must be center of focus. They must want to get better, and they must be willing to put in the time and the effort to do that.
You mentioned depression there in the course of you chatting to me, and I'm just thinking about emotional trauma as well and the part that plays in brain health.
Absolutely it does. And we see this primarily in children, and we talked about it just briefly about autism and autistic spectrum. Is trauma at birth, is the use of forceps and vacuum delivery, I'm seeing it in my clinic. I can produce patients whose children who were born through vacuum forceps type deliveries that in some way impacted upon the nervous system of the child. We're seeing an autonomic nervous system overload. That's what I see in my clinic. So that because for whatever reason the vacuum and the suction and all of that it's impacting the brain, because it's stuck in that birth canal. The mother is under stress. There's stress hormones being fired out by the mother. The child is reacting. Placenta is going into stress. Oxygen delay is getting to the brain. And this is trauma, whether we like it or not. And trauma to the brain, irrespective of how it's caused or created, whether it's through emotional stress or whether it's through some impact, whatever the impact is, emotional, physical, environmental, whatever type of impact is, if there is trauma to the body, it affects the brain. If there is direct trauma to the brain, then it may manifest in addictive personalities or certain types of personalities as we get older. We're seeing that if we can work at an early stage to release that stress stress, the brain can begin to rehab itself and recover. And again, that is what science is showing us. Rather than just the idea that, well, we need to medicate. We can't medicate our way out of problems. For sure, medicine has a role to play, but we can't medicate our way out of problems. We've got to go back and look, as you said earlier, what is the correct diagnosis? Meaning, what is the cause of your problem?
How do you approach it when somebody comes in to you, whether it's emotional trauma or it's trauma brought on by something else, overeating or what? How do you approach them?
For the first thing, obviously, we have to make patients aware of they're coming in from a clinical environment, they have had their medical test, they have all this kind of stuff done. So we have to first of all then talk with them about, just like what I'm saying, what is the cause of your problem? Where is it coming from? So we get into this dialogue. The first day now is nearly part of just sitting down. Then we proceed to work with the energy system of the body. This is critical. Once we start to work with the energy system of the body, we start to release that stress and trauma from that impact emotionally or physically. Once we start to do that, then we engage them in mind skills to get them to look at their future, how it is they're going to emerge, the attitude they need to have, then supporting that with the right diet, then supporting that with the proper physical exercises. Then if medicine has a role to play, so be it. Whatever it takes, that's the road. People need to be patient. That's the biggest message we give our clients. You have to be patient. Patience doesn't mean nothing is happening. Patience means that you're working slowly towards an end game. You're working slowly towards your goal of 3, 6, 9 months where you're back to health. I had a gentleman in my clinic about 3 months ago who presented with Parkinson's symptoms. And I said to him, if you want to try to deal with this, this is what you have to do. And he did it. He has lost over 35 pounds. He is now presenting with no symptoms of Parkinson's hardly. Even his neurologist said this to him. And this is just in 3 months that he decided to take it on board himself, to make the changes with his nutrition. So we're seeing that when people do engage, that they can change.
So are you saying to me, Michael, that just because you get a diagnosis, it isn't you can approach this yourself?
Absolutely. And even with cancers and so on. And the point I'm making is that you take the amount of stress associated with different types of cancers and, and different types of conditions and so on. Like the stress alone, working with the model we're talking about can have huge impacts in dealing with stress. And at least just by working with the stress, it can help the body to react better to the treatments, if it's chemotherapy or radiotherapy or surgery, whatever the case may be. So it's all about presenting to people the best opportunity and the best outcome, and to do that you need a multidisciplined approach. That is the only way about it. There is no other way. So the idea that there's only one way.
You've seen people reverse the situation.
Absolutely. Well, absolutely. I mean, we're seeing it all the time. Children, with different types of conditions, parents with, and it's on my YouTube channel, and you'll see people there who've recovered from depression, from people who've recovered from gastric issues, from ulcerative colitis, where bowels are supposed to be removed, and we're able to reverse that. We're seeing people who are chronically fatigued, who are burnt out, who are on huge amounts of medication, who've recovered. Well, I'm not saying this is the panacea and the be-all. What I'm saying is this, that if we really want to confront the modern day health issues, the processed food diseases, the obesity, all of these types of problems, where to prevent conditions like what we're told now, that vascular dementia or Alzheimer's could quadruple in the next 25 years. If that's the case, we need to bring a different sort of approach to people and get them to begin to take care of themselves, Fran. That's the only way forward.
A listener with a very good question, they're wondering, do you have an opinion about the condition and the state of our water, for example? Do you have issues with that?
The three things I believe is poisoning us: air, water and food.
The water?
Well, water is poison. We under no illusion about it. What is going into that water, what has been cleaning it. I spoke with a guy many years ago, and he said, Michael, I go to reservoirs, and when I go to the reservoirs and I look into those reservoirs, I often see dead sheep inside them. He says they're black. By the time it comes out at the other end of the pipe in your tap, he says, it's clean, it's white. But what's making it that way?
Fluoride, I suppose.
This is the thing about it. When we look at nature, we have disrupted nature. We have affected how the natural process. And whether we like it or not, either we're talking about global warming and we're talking about the climate. we won't be around to experience the worst of this climate if we keep going. We are fast. You know, we have 8 billion people in the world at the moment.
We're destroying ourselves.
We are destroying ourselves. We're fast destroying ourselves. It's up to each individual. It has to be an individual thing. Fran, if you look at people and if people individually decide, you know what, I'm going to take responsibility of my life here. I'm going to sit down. If I have to filter my water, I'm going to filter my water. If I have to, I'm going to get the best food I can possibly get in. I'm going to disconnect from a lot of the negativity that's going on in social media at the moment. I'm going to find time for myself to get out into nature, and I'm going to start learning to relax and to meditate. Keep learning something. Pick up an instrument and learn to play music, no matter how bad you are. But the key is keep stimulating growth in your body. We have seen, science has shown, if we go down that road, we can change our lives. And that's not just a fanciful idea. That's not just hear me giving some motivational speech. This is what science is saying, and this is how we can really deal with it. So yeah, unfortunately, but when we talk about air, water and food being toxic, it's our thoughts are more toxic than them all.
Yeah, I go along with that. Yeah. Yeah.
I mean, people are out
we
there.
We can destroy ourselves.
We are destroying
with
ourselves.
Our thoughts too,
we are destroying ourselves because but when you look at that, though, when you have, the economic and political institutions projecting negativity for people.
All the time. Yeah.
All the time. So what is that? It's a subliminal information going into our subconscious mind, and people are living in fear. People were preparing for the beast in the east, and now we have Varadkar coming on saying, oh, well, we might have to turn off the light. I mean, there are people who are continuously being bombarded with a projection of negativity. Christ, I mean, these guys call themselves leaders and motivators and so on, and visionaries. I mean, we are driving ourselves into the deepest hole continuously. Someone's going to have to take the bull by the horns and start directing people down a different direction, Fran.
If people want to talk to you, Michael, if they want to link up with you, how can they do that?
Yeah, michaelodoherty.com, obviously, or my office is 08767218888. And in the new year, Fran, just briefly, I'm planning on getting people out into what I call green zone therapy.
Okay.
And the whole idea is what I want to do is get people out into nature and just talk with them, teach them how to breathe, do a little qigong, meditation, get them to understand food, and if they have issues, begin a process of helping them to recover. So I'll be starting this next year, certainly starting in January. I'm looking to start around the 7th of January.
Well, we look forward to that indeed.